and good morning to all of you all, and to our visitors in the gallery today, and those watching at home and places of work. I rise to deliver my ministerial statement today with a focus on the efforts that the ministry, through the Wellness Division, is undertaking to address the burden of non-communicable disease in our country. Non-communicable disease contribute to be the main disease burden for our people, contributing to 80% of all deaths in the country and 40% of premature deaths. In the recently published Republic of Fiji Vital Statistics Report of 2016 and 2021, circulatory disease such as hypertension, heart disease, and stroke, diabetes, and cancers were the leading causes of death in Fiji in both males and females in all ages combined. For adults aged 35 to 59 years, the leading cause of death in men and women were non-communicable diseases. NCD also poses a significant burden on our health system and our society. The majority of admissions and treatment at our health facilities are due to NCDs and its complications. Complications such as coronary artery disease or heart attacks, stroke, kidney disease, kidney failure, vision impairment or vision loss, peripheral vessel disease that requires surgical interventions, including amputations, bring patients to our hospitals every day and require ongoing care in our health facilities and in our homes and communities. In 2019, the healthcare costs for deaths and disability from NCDs, such as diabetes and obesity-related illness, was estimated at 591 million Fiji dollars. Honourable Speaker, sir, the 95% of NCDs are due to lifestyle choices, and the four main modifiable risk factors of NCDs are tobacco use, physical inactivity, unhealthy diet that is high in salt, sugar, fat, and processed foods, and excessive alcohol consumption. These unhealthy lifestyle habits led to four key changes in our body that increase our risk of NCDs, and they are raised blood pressure, high blood sugars, high blood cholesterol or fat levels, and obesity or overweight. The Fiji 2021 multiple indicator cluster survey showed a significant level of unhealthy dietary practice in our older children, adolescents, and adults, which featured low consumption of nutritious foods and a high intake of sugar and sweetened beverages. The survey also noted that about one-third of children in Fiji between the ages of 5 and 19 were overweight. When uncorrected, this presence of these intermediate risk factors leads to the development of NCDs. Mr. Speaker, in response to the NCD situation in Fiji, the Wellness Division of the Ministry is tasked amongst its many roles with undertaking population surveys, often with the support of our partners, to assess the prevalence of risk factors of NCD and its complications in the community. Information gathered from these population surveys guide the strategies of the health promotion and NCD prevention programs that are implemented by the Ministry and the government to address NCD in Fiji. Recent examples of such interventions include the Cabinet-endorsed National Policy on Healthy Catering and Sale of Food and Beverages for government ministries and institutions, which was launched by the Honourable Prime Minister in February this year. The increased tax on sugar sweetened beverages and tobacco, which government had implemented in the last financial year and again in this new financial year. It has been pleasing to note that many government institutions are taking positive actions to adhere to the healthy catering policy, such as Bundau Hospital in the Naitasin province, whose pictures of delicious, colourful and balanced meals provided at the hospital are currently trending on social media. Honourable Speakers, allow me to talk on the NCD STEP survey. An important NCD population survey that the Ministry has embarked on since June 2024 is the STEP survey. This survey is World Health Organization stepwise approach to NCD risk factor surveillance, which is a simple, standardized method for collecting, analyzing and disseminating data on NCD risk factors in countries. The survey has been implemented in over 120 countries, and it gathers information on risk factors, with a questionnaire followed by simple physical measurements of respondents, which is then followed by the more complex collection of urine and blood samples for biochemical analysis. This is the third time that the STEP survey in Fiji. The first one was carried out in 2002 and the second survey in 2011. Ideally, Honourable Speaker, sir, STEP survey should be done in every 5 years. The 2011 STEP survey was a nationally representative population-based survey of 25 to 64-year-old Fijians covering 2,586 individuals across Fiji. The results of the 2011 STEP survey showed that 30% of adults smoked tobacco daily. 15.7% of adults consumed alcohol within the past 30 days. 15% of adults do not meet the WHO recommendations on the minimum level of physical activity for health. And 85% of adults ate less than 5 servings of fruits or vegetables on an average day. For the intermediate risk factors, 32% of the respondents were obese, while 70% were overweight and obese. 31% had raised blood pressure, 15.2% had raised blood glucose, and 35.8% had a 3 or more risk factors. The STEP survey is among a number of important population health surveys that have been pending over the last decade, which the Ministry is keen to undertake to guide its health strategies in the next 5 years. Honourable Speaker, sir, with the support of the Australian Department of Foreign Affairs and Trade and the Secretariat of the Pacific Community, the Ministry has commenced the third STEP survey for Fiji. The survey is in line with our National Health Strategic Plan and the Annual Operation Plan. For the first time ever, the Ministry has engaged the assistance and the expertise of the Fiji Bureau of Statistics in carrying out the survey on risk factor behaviors among males and females aged between 18 to 69 years. Also, for the first time, Fiji will be introducing for the rest of the world a cervical cancer module, a Suki and tobacco module, an oral health module, and extended nutrition questions and mental health modules and urinalysis during the survey. These are the new modules under the STEP survey, and Fiji is proud to be involved in drafting and piloting these assessment modules under this comprehensive survey. By the end of the last financial year, the survey for the Eastern Division were nearing completion, with surveys conducted in Kandangu, Ovalau, Utuma, and Lakamba, and in the Lau group. In this financial year, funds totaling $480,000 have been allocated from the Wellness Division for the completion of the STEP survey in the North, Western, and Central Division. The benefits of the survey, Honourable Speaker, sir, the results from the STEP survey will inform on the impact of the population-based interventions for our people over the last 10 years. The result will help the Ministry track its progress towards the global NCD action plan of a 25% reduction of premature mortality from NCDs by 2025, as well as Sustainable Development Goals Target 3.4, which calls for reducing premature deaths from NCDs, including diabetes, by 30% by 2030. The survey results will provide further guidance on a number of current NCD strategies by the Ministry, such as the Healthy Settings Program, which has resulted in communities declaring their villages and community halls tobacco-free settings, and workplaces adopting Wellness Wednesdays, our school health policy, and health-promoting school program within the Ministry of Education, and our current effort to establish, with the support of our partner, an electronic information system for recording and reporting diabetic cases. The survey result, together with recommendations from the recently completed health survey conducted by World Bank and our upcoming health system evaluation exercise, will guide the Ministry's future National Wellness Strategic Plan. Honourable Speaker, sir, I wish to conclude by reiterating that I have said previously in this August House that NCDs do not start when one is diagnosed inside our hospitals and nursing stations. They start with the living and eating habits that are nurtured at a young age in our homes, schools, villages, workplaces, and offices, and also in deliberations on this August House. The NCD burden we have will require our collective effort and determination to control and stop. And I wish to encourage all Fijians around the country who are approached to participate in the STEP survey to fully participate and complete all the steps of the survey. And I wish to acknowledge and thank all our partners who are supporting the ministry in completing the survey in 2024. Thank you, Honourable Speakers.
Thank you, our level Honourable Minister for Health. Honourable members, I now wish to suspend proceedings so we can adjourn for tea. And the Secretary and your colleagues are all welcome to join the honourable members during tea. That's a very hard-working member of the government. I don't know whether he still belongs to PEP or Sudelba. He's from Lomaiwiti, but born and bred in Rakiraki. Thank you, honourable members. We now adjourn for tea.